what is HDL and what is LDL and why are they important and what are they doing to help the heart or hurt the heart?
Yeah, so people, when we start with cholesterol, everybody looks at their total cholesterol number. And historically, we got nervous about total cholesterol numbers greater than 200. We've since found out that there are other particles, that they're different shapes and they have different mechanisms within the body. HDL, we like that. That's the good cholesterol. Again, as I described it, it's usually the cholesterol that's going away from the arteries back to the liver.
So what's it doing, the HDL? Why is it good?
So we know that it's protective of heart attacks. The higher that number is, the better off you're going to do, the lower risk you are of having heart attacks and strokes.
If you've got a good HDL, does that help the coronary artery that's been rusting, the rusted pipe? How does the HDL help that?
Yeah, usually it's a prevention level, so that most of the time it's not that it takes away the plaque, it's that you prevent yourself from having that plaque. We can't treat HDL too well with pills, however. It's better with exercise and diet. That seems to have more long-lasting effect with HDL versus its close cousin LDL, which is the bad cholesterol.
So the LDL, the bad cholesterol, what's it doing to the pipe?
Yeah, and that's the cholesterol going from the liver, being manufactured, going out into the body, and that's what's rusting your pipes.
Okay, so that gets inside of the blood vessel, forms cholesterol plaques that are in there, and that's the hardening of the arteries.
Yes.
Does that occur just in the heart arteries, the coronary arteries?
Yeah, it's again, the vascular tree is throughout your entire body. So we see it in the legs, we see it in the aorta, we see it in the heart, we see it in your head. And so vascular disease is a systemic disease, not just a one organ disease.
So when it's going on in the lower extremities, going on in the legs, what are the symptoms there sometimes?
Yeah, we call those symptoms claudication. Claudication is like angina for the legs, but it's usually calf cramping or aching when people walk up hills. If it gets more progressive, the entire leg can start to ache as well.
And if they're exercising and start getting leg cramping, when they stop and rest, it gets better until they start walking again.
Yeah, exactly.
What does that do around the kidneys and some of the other organs? Does the blood vessels go into the kidney, do they get diseased?
Yeah, they can, and that's what can cause earlier progressive kidney dysfunction or kidney failure, is cholesterol plaques in the teeny tiny capillary area. So patients with uncontrolled hypertension or diabetes, that's a stronger predictor of atherosclerosis, do have higher rates of kidney disease as well.
What's going on up in the head?
Yeah, strokes are common too, and so again, this cardiovascular term that we use, the good news is that how we treat them all is the same mechanism. We can stent head, we can get clots out of the head, we can do the same thing in the heart, and we can do the same thing in the legs as well.